Hi there. Today our topic is 3D areola tattoo. What is it? What's the process? What to expect? What's the aftercare, average cost, and how to book? So first of all, what is areola tattoo? Give me 1 second. Um, so basically what areola tattoo is it's a specialized type of tattoo that's supposed to mimic the appearance of your natural areola and nipple. So it's usually performed post mastectomy. So if a woman has breast cancer and they are required to get a mastectomy, oftentimes they lose their areola and nipple. Some surgeons leave it on, but it's not as common as losing the areola and nipple. So basically, the whole goal is to make it look really hyper realistic and have that three-dimensional effect to make the nipple pop. And that's exactly what I do here at the Medical Tattoo and Medical Tattoo Denver. Another reason to get an areola is post-op surgery. So whether you transform female to male or male to female, again, oftentimes during that procedure, people will opt to have their areolas removed, which is great because then we can just tattoo them back on in different sizes and shapes and colors and all that fun stuff. So those are the two main reasons of receiving a 3D areola tattoo. So who's a candidate? Well, we kind of just went over that. Anyone who went through a mastectomy or a top surgery and lost their areola is an amazing candidate. I also do areola correction tattoo, but we'll talk about that in another video. But it's basically for women who, or men who went through breast surgeries and for whatever reason lost pigmentation in their areolas or part of their areolas, and then I'm able to correct that as well. So what's the process? Well, step one, you can always book with me for an in-person or Zoom consultation if you'd like, or if you're ready to just get it done, you can book with me online and I'll talk about that in a second. But basically you'll come to my studio, which is here. We will take some before pictures. Then we're going to choose placement. So we'll have you stand in front of me real tall and we'll choose where you would like your areolas placed on your chest. Usually it looks best in the center of the breast mound, but some people prefer up and some people prefer down. But we'll make sure they're even and that they look as good as we can possibly get them. The next step is choosing colors. So this is one of my favorite parts. I like to look at your skin tones, your undertones, your overtones, and kind of get a feel for what natural colors would look best on you. I do ask women, and this is really hard because most people don't have before pictures or even remember what their areolas look like. So if you're watching this video before your mastectomy, and you want something similar to what you have now, I would highly recommend taking a picture and bringing it to your tattoo artist. And that way they can kind of gauge color and size and placement that you had before, which will make it easier to transition to your new breast. Otherwise, we can choose all sorts of fun colors. I have a ton behind me, from pinks to browns to blacks. I mean, the sky's the limit. I've done areola hearts before, which is kind of cute. So really, it's fun to play around and see what we can come up with and something that you love and that you'll love forever. Because again, it is a tattoo. Then after that, we will start the procedure. So a lot of people are nervous, understandably. I'm always nervous before any procedure that I don't know what's going to happen. But rest assured, 99.9% of my patients do not feel a thing. There's a lot of numbness after reconstruction. There's not a lot of feeling. So I don't know if you can see, but I have a beautiful TV up here. Generally, I talk to my patients, but sometimes we'll put the TV on like during the Olympics and zone out, and my patients can enjoy that because it does take at least an hour, sometimes 2 to 2.5, just depending on if you had radiation or how your skin is taking pigment or what size you want, all those things. So I will start the tattoo process, which is my my actual favorite thing to do. I have had extensive training. I've had obviously my fundamentals courses, which I took at Prettyology Academy. I live in Colorado, but I actually flew out to Massachusetts for that class because they're amazing. And then I took an advanced areola course with world-renowned Vicki Martin. And that is, you probably haven't heard of her if you're watching this, but I mean, this is the cream of the crop in the world. So I have all the advanced techniques you could possibly learn from Vicki Martin, which is awesome. So I will go ahead and tattoo you. You probably won't feel much, maybe a little prickling if you do have some sensations, but nothing that's uncomfortable by any means. After the procedure is over, I will take after pictures and then bandage you up with Tagaderm, which is a medical grade bandage. If you're allergic to Tagaderm, we'll skip that and find another solution. But the Tagaderm is great because it stays on your breast for 7 days. It's clear, so it's like a little windshield that you can still look through at your areolas as they heal. You can shower with it every night. You can shower the night of. The only restrictions for aftercare is you do not want to sweat for 7 days, so no heavy workouts, no sauna, steam rooms, baths, pools, basically anything but the shower. After the 7th day, you're going to get in the shower and soak the area and slowly peel off the Tagaderm. From there, you're going to start using antibacterial soap morning and night, gently just with your hands. You're going to apply Aquaphor morning and night as well. If it does get a little cracky or dry, you're going to apply even more Aquaphor. That's the healing process. It's pretty straightforward. Your areolas will look darker before they lighten and soften into their final state. So what you see when you leave here is not your final result. I generally have 2 appointments, 6 to 8 weeks apart, and the second one is just a touch-up appointment, so we can put in more detail, Montgomery glands, wrinkles, make it pop a little bit more if we need to, but it's not, I guess it's not necessary, but I always offer that for free. It's included in the price. Oh, and another thing to think about on top of that is, every breast is different, and although they look fine from the outside, there's been obviously a lot of trauma going on underneath. So I am working with compromised skin. So it's not like going to a tattoo artist that does like decorative design. We have to be very careful with this skin, especially if the breast has been radiated. Sometimes it won't take pigment as easy. Everybody's very different. So that's why there are paramedical tattoo artists, because we know how to deal with breasts who have been through literally the ringer. So that's something also to keep in mind. So we talked about aftercare. As far as the cost goes, I've kind of been looking online at like the average cost. I've seen between $400 to $1,800 across the nation. I personally I'm right in the middle of that price point. Insurance will cover this procedure. Not all insurances do. I know Kaiser, I have a patient trying right now, but we'll see. Kaiser usually doesn't, Medicaid and Medicare don't. The rest do. Some cover it straight up right away. Others, like with top surgery, sometimes they make you reach your deductible first. But I will be sending you home with a super bill. Or if you want a pre-auth prior, I can give you the CPT codes to call your insurance and see how much of it is covered, which it should be covered. I mean, it's you guys went through so much. So yes, most of the insurances will cover this procedure for you, which is awesome. Longevity. So all tattoos fade. I use pigments. All paramedical tattoo artists should use pigments. A lot of the pigments I use are made by Vicki Martin, who was my trainer, which is really cool. So they do fade over time. I think most people require on average a touch-up about every 5 years or so. But some people came to me like 20 years later. I don't know who their tattoo artist was 20 years ago, but they're still on there pretty good. So it just depends. As far as booking with me, you can go to themedicaltattoo.com or medicaltattoodenver.com. And on both of those websites, it says book with me. Just click on it. It'll take you to my Vigaro page where you can book a consultation in person or Zoom, or you can go ahead and just book your appointment out. Please let me know if you have any questions. I hope that was helpful for you. If you have any other questions you'd like me to address, just post them below or contact me and I'd be happy to help you. Okay, thank you for watching this long video, but hopefully you're more informed and ready for the process. Okay, bye.